Hi, I'm Kathrin, the Director of Training and Education here at Osteostrong Sioux Falls. Today we're going to talk about the osteoporosis crisis, why exercise is actually not the answer to the problem, and what steps you can take to take your own bone health into your own hands. So let's get started, and I'm going to go ahead and share my screen with you now.
Welcome and thank you everyone for joining us for our presentation on staying bone strong. So first off, we are going to talk about why bone health is important. A lot of people think about bones as those hard and lifeless structures, but they actually are living and growing tissue. So they are involved in a lot of processes in our bodies. To support our bone health, we can do different things like incorporating osteogenic loading, which is something that we do here at Osteostrong all day, every day. We can work on supplementation and an overall healthy lifestyle. So what can you do to minimize your own bone fracture risk? You can complete a fracture risk assessment. We are going to provide you with the link to that assessment at the end of the presentation. You can also read up on the American Bone Health article and then enjoy our short presentation on osteogenic loading today. So why is bone health the key to healthy aging and longevity? At this point, bone health has become a billion-dollar health problem. So we are going to talk about bone health and aging, why exercise is not the answer, and we're going to talk about a better way to strengthen our bones. First off, I would like to talk a little bit about the different functions that our bones provide us. So they protect our internal organs, they provide us with frame and shape of the body, they are involved in blood production, they're also a mineral reserve primarily for calcium in our body, they obviously help us with movement, and they provide acid-base balance in our body and also aid in detoxification. We'll talk about bone health with age. It has now become a $17 billion problem, and it costs us $17 billion annually. About 44 million Americans are at risk of some kind of bone fracture at this point. 50% of women and 25% of men will be affected by osteoporosis in their lifetime. 20% of hip fracture patients die within a year due to several different complications, and 50% of hip fracture patients are disabled for life. I find those to be very sobering statistics. So let's talk about osteoporosis. It is a prevalent but also preventable issue that a lot of people are dealing with. There are some risk factors that are completely out of our control, such as gender, age, race, family history, and our body frame size. But there are also a lot of factors that are very much under our control, such as a sedentary lifestyle, excessive alcohol consumption, tobacco use, and certain medications. When we look at the life cycle of bone and muscle, we can see, looking at this graph here, that our peak bone mass density is around age 30. So we continue building those strong bones until we reach age 30. So this is a little picture here. It's a nice, strong, healthy bone. And then from then on, we are going to lose between 1 to 2% of bone density every single year. During menopause for women, that actually speeds up to 5 to 6% every year. So there is a significant amount of bone loss happening even between the age of 30 and 50. It is not something that most of us really think about because there is not a little bell going off in your body telling you that you're starting to lose bone density. But if we really pay attention, there are quite a few signs that our bones become weaker. So as those bones decrease in density, our muscular strength also decreases because your body will never allow your muscles to become stronger than what your bones can handle. Also, your balance is getting worse over time. Your posture is a lot worse over time. You are noticing an increase in joint and back pain, an increase in blood glucose, and also an increase in risk of fall and injury. We have several different cells that are involved in the process of remodeling your bones. We have little cells that are called osteoclasts. We see those little guys right here. They are responsible for taking out that old, low quality cells in your bone. And then we have the little guys called osteoblasts that are responsible for building new bone tissue. The thing is that if those little osteoclasts work harder than those osteoblasts, we start decreasing in overall bone density and are then eventually diagnosed with osteopenia or osteoporosis. Since our bones are living tissues, they are constantly under this remodeling process. This is a little bit more realistic image of osteoblasts laying down new bone tissue there and osteoclasts sucking up that old low quality bone tissue that is no longer needed. Here's an image of what normal bone density looks like, what osteopenia looks like, and osteoporosis looks like. So why is exercise not the answer? We know from several different studies that in order for your body to start laying down new bone tissue, which is called osteogenesis, we need to provide the body with about 4.2 multiples of your body weight in force to trigger that response. So your bones actually adapt to its environment. So weight-bearing exercise comes in many different forms. So traditional exercise is fairly safe. It is also very low in multiples of body weight, so low force, which is also nice for your joints, but it just really doesn't cut it for your bone density. So that is yoga, hiking, biking, swimming, walking, all wonderful exercises, but they only provide you with about 1 to 2 multiples of your body weight, so not nearly close to that 4.2 that is needed. Some high impact exercises are not safe. They're really hard on your joints. They have a really high risk of injury, but they do provide you with enough multiples of body weight to trigger that bone growth response in your body. So Olympic powerlifting, gymnastics, or some jump exercises. So what we really need is something that is very safe for your joints and for your overall health, but also enough to actually trigger that bone growth. And we get both of those benefits without any of those risks in osteogenic loading, which is what we do here at Osteostrong. So it is really a better way to strengthen your bones, the Osteostrong way. We know from Wolff's Law back in the 1800s that our bones and muscles adapt and respond to heavy loading and impact of forces. So that is how we know that your body is capable of really adapting to what it is put under. We're talking a lot about hacking the body system here. So your brain is your command center. It is completely in charge of what your body is doing and how it adapts and responds over time. That adaptive response is triggered in certain ways. So when you step outside into the sunlight, your brain senses that there is too much sunlight coming into your pupils and automatically constricts your pupils. It's not something you have to tell your body. Your brain automatically sends out that command. That is what we call that adaptive response. The same is true for our bones. So the trigger event is the amount of force that we put onto your bones. So the developer of our system that we use here called Spectrum System is Dr. John Jackwish. It's a really beautiful story. So his mother was in her 80s when she was diagnosed with osteoporosis, and he set out to develop a way to help his mother reverse her osteoporosis, and then ended up developing this Spectrum system that has changed countless lives. The benefits of osteogenic loading is it increases bone density, it also increases your muscular strength and your balance and your posture. We've seen wonderful decreases in joint and back pain in our members. It also helps reduce your blood glucose level, and it decreases your risk of fall and injury. And all of that in only 10 minutes, one time per week. The Osteostrong method is completely safe. You have absolutely no impact. You're always in your strongest and safest position. It is all the benefits of high impact without any of those associated risks. It's completely sweat-free and pain-free. And the best way to show you how this works is by playing a little video of one of our coaches and one of our members.
Always fast and fun here at Osteostrong. Our sessions are once weekly, always accompanied by a session coach. We have a 4-machine circuit that you go through every week. One for the lower body, one for the upper body, one for the core of the body, and one for the spine and postural systems of the body as well. By the time you're done, we've effectively loaded all 206 bones of the body and strengthened all the muscles, ligaments, and tendons that attach to those bones as well.
So why do we only do sessions here once per week? Every tissue type in your body has a different recovery rate. Toenails grow a lot slower than fingernails, for example, and our bones are very slow in what they do. Bone tissue needs approximately 5 to 10 days to fully recover. So you come in here, you do your session, you do it to your maximum capability, and then you let your body do its thing, putting down that new bone tissue for the next 5 to 10 days. And then your body is fully recovered and you come back and you just trigger those benefits again. We do have some amazing additional services as well that really help you maximize benefits that you get from your loading session. We have a red light therapy. It's amazing for skin rejuvenation. It's great for decreasing any kind of inflammation. We've seen amazing results with eye health, so people that have floaters or dry eye. And then we also have a pulsed electromagnetic therapy mat that people lay on. It's amazing in reducing inflammation in your body. It's great at helping your body rebuild that bone tissue. It is very relaxing. It can help with sleep. It can provide you with more energy and many other benefits. We have some amazing testimonies here from our members, and Jo said it best, so I'm going to play the video and you can listen to her testimony.
Hi, my name is Jo, and I belong to Osteostrong and started, quite a few years ago, right after they opened. And I knew to come here because my daughter did a great deal of research on what would help osteoporosis. And she came across this program. She called Rapid City and found out they had Osteostrong and said, would you consider putting one in Sioux Falls? And they said, oh, we just opened one. So she called me and she said, Mom, get down there, you're going. So I joined, and my results have been fantastic. I got a phone call from my doctor's nurse last week. I just had a DEXA scan done, and I thought, oh boy, doctor's nurse is calling me, must be bad. She said, no, everything great. You have a big increase in your spine and in your hip, and I am no longer considered having osteoporosis. I have osteopenia, and I am so excited. And the best part is, the nurse said, doctor wants to know if you're still going to Osteostrong, and I said, of course. And she said, doctor said not to quit, keep going. So I am thrilled with the program, and I hope everybody that has osteoporosis or osteopenia should be here, man or woman. My husband comes here too.
We also have another testimony from our member Michelle. She had really good increases in her spine, in her left hip, and in her right hip. And Jan also shared a beautiful testimony about her back pain. Her back pain was really severe when she started with us and has made major improvements since starting with us, and also had really big gains in her bone density. Her spine increased by 3%, her left hip by 3.7%, and her right hip increased by almost 10%, which is absolutely amazing. So are you ready to try it? The benefits of being a member here is you get weekly sessions one-on-one with one of us certified session coaches. You get a regular progress report and goal setting sessions. We're friendly, we're encouraging, and completely non-judgmental here. And you also have access to other franchise locations if you enjoy traveling. Thank you so much for joining us for our Bone Strong presentation today.